Hello, good morning, good afternoon, good day to everybody. I'm Dr. Onya and I'm a general practitioner and I'm working at Poppy Baptist Hospital, Douala. And today I would like to talk to you about an ectopic pregnancy. So, what is an ectopic pregnancy? An ectopic pregnancy is a pregnancy that implants out of the normal side of implantation of pregnancy. That is, the pregnancy does not implant into the woman's uterus, it does not implant into the woman's womb, it implants outside from the womb and is mostly at the levels of the fallopian tube. Now, when a woman has sexual intercourse, she's expected that the egg is fertilized, and when there is fertilization, the egg is expected by day 6 to implant in the uterus. That means the egg leaves the fallopian tube and it is implanted in the uterus in order for a normal pregnancy to grow. But in case of an ectopic pregnancy, that is not what happened. That egg stays in the fallopian tube and begins to grow. And that pregnancy cannot continue because a baby that will come out with that size of a normal baby that we all know will not be able to grow in the fallopian tube because the size of the fallopian tube is not like the normal regular size of the uterus. It doesn't have that capacity to withstand the size of a growing baby. Now, how can you know you have an ectopic pregnancy? The signs and symptoms of an ectopic pregnancy. Usually, there is no sign specific to an ectopic pregnancy, but now there are some signs that can make you think you have an ectopic pregnancy. That's why it's always advisable, once you know you are pregnant, it's always better to get a first trimester ultrasound. That's in the first early weeks of pregnancy. Do have an ultrasound to confirm the site and location of your pregnancy. Now, it's always good to do an ultrasound between that's 4 to 7 weeks. It's always good to do just a confirmatory ultrasound to investigate where your pregnancy is located. And because if you are pregnant and you have symptoms like you have a missed period, for example, and you're presenting with a lower abdominal pain that usually starts on one side, that is, the pain is unilateral. The second thing is you may have vaginal bleeding. It may be mild, it may be moderate. But if you're having this sign, it's okay for you to suspect that it's an ectopic pregnancy. What I'm trying to say is that if you have the above signs and symptoms, it doesn't necessarily mean you have an ectopic pregnancy, because there are other causes of why you may be bleeding and experiencing the above signs and symptoms in pregnancy. It may be a threatening miscarriage, that's a threatening abortion. It may be an incomplete abortion. There are several causes of why you can also experience those signs and symptoms above. Now, how can one get an ectopic pregnancy, or what is going to make one being at risk of having an ectopic pregnancy? Okay, there are some risks that may make you prone to have an ectopic pregnancy, like when you have a previous history, you have a previous history of an ectopic pregnancy, you have a prior, that's you have had a tubal surgery before, that's your fallopian tube, you have once had a surgery for it for one reason or the other. It may be because of an abscess that was at the level of your tube. That means you have a history of a pelvic or abdominal surgery. There's another risk that says if you have certain sexually transmittable infections, you may also have pelvic inflammatory disease. That's pelvic infections like chlamydia, syphilis, gonorrhea, and you have endometriosis is a risk factor. Another risk factor is when you have an intrauterine device. That's an intrauterine device to prevent normal implantation of pregnancy. It's a method of contraception. Another thing is there are other factors like that are not really common, like the factors I have mentioned above. We have age above 35 years, history of infertility, use of assistant method of reproduction like in vitro fertilization. Now let's move next to how do we manage an ectopic pregnancy. Now an ectopic pregnancy is managed depending at the level of which your ectopic pregnancy is. Now in some patients, an ectopic pregnancy is diagnosed when the ectopic pregnancy has already been complicated, while in others it is diagnosed when the pregnancy is still at the level of the fallopian tube, there is no complication, everything is moving on smoothly. Now, a woman also can come to the hospital and just to do her regular ultrasound without having any of those signs and symptoms, and we notice that in the ultrasound indicates that the pregnancy is not located in the fallopian tube. Sorry, it's not located in the uterus, but instead at the level of the fallopian tube. How will an ectopic pregnancy present at the level of the hospital? Your ectopic pregnancy can present if it is ruptured or not ruptured. That's, you can start feeling those signs and symptoms that the ectopic pregnancy is in place, or you start feeling those signs and symptoms, you experience those signs and symptoms when the pregnancy has already started growing in size and the fallopian tube is unable to contain the size of that pregnancy, and it ruptures, like the fallopian tube bursts. It bursts and the pregnancy gets into the abdomen and you start bleeding from the ruptured fallopian tube. Now, it depends at what level you present with your ectopic pregnancy. It's also going to relate to the specific treatment that you're going to expect each time you have an ectopic pregnancy. Now, if a woman comes to the hospital with an ectopic pregnancy which is ruptured or not ruptured, what happens is this: you come with those signs and symptoms, they'll send you for an ultrasound. We do an ultrasound, it tells us whether you have a normal pregnancy or it's an ectopic pregnancy. It also tells us whether the pregnancy is ruptured or still in place. Now, the expectant management of an ectopic pregnancy is like this. If a pregnancy that is ectopic and it's not complicated by any signs of rupture, excessive bleeding, we will expect that pregnancy to be managed medically with a certain medication. That medication is going to be injected into you to dissolve that pregnancy. Now, if you come to the hospital that pregnancy is already ruptured, I'm sorry, but you're going to be operated upon in order to rebuild the tube that has been destroyed, and you are going to be operated upon in order to take that blood away from your abdomen, because bleeding into your abdomen will also lead to pain in the abdomen generally. Now, they will operate you and you'll be okay, and your tube, the other tube, is safe. You still have a tendency of getting pregnant. Now, what are the complications of an ectopic pregnancy? The first complication of ectopic pregnancy is this: we have rupture. That's pregnancy rupture, ectopic pregnancy rupture. That is a complication. Now, when this pregnancy rupture, it can lead to excessive bleeding, leading to excessive loss of blood. That is going to make you. This excessive loss of blood can make you enter into shock. You might even need a blood transfusion. Now, there's another complication called peritonitis. What I'm trying to explain is peritonitis is a condition in which you have abdominal walls irritation as a result of the blood of the ruptured fallopian tube that gets into the abdomen and irritates the abdominal walls, and it makes you to start experiencing this generalized abdominal pain. The pain may even move right up to your shoulder level. That's a sign of a peritonitis. Now, and that is a surgical emergency. When you have an ectopic pregnancy and you are at the level of ruptured and peritonitis, that is an emergency. You need to be operated upon. Maybe you may need transfusion as a result of excessive blood loss. In the worst case scenario, complication of an ectopic pregnancy, it may render you infertile. given the sense that you had a previous ectopic pregnancy that ruptured, and the second time you have a second ectopic pregnancy that has ruptured, so it may even lead to infertility. That you're unable to get pregnant, because for you to get pregnant, fertilization must take place in the fallopian tube in order for it to move down into the uterus. Now, if you have a ruptured ectopic pregnancy twice, it renders you infertile, except you're going to go through artificial means of fertilization like in vitro fertilization. Now, let's look at the take-home message in everything I'm trying to explain as regards to ectopic pregnancy. I'm saying if you are pregnant and you confirm you are pregnant in the early weeks of pregnancy, between 4 to 7 weeks, and therefore you have an ultrasound, that's an echography, to confirm the location of your pregnancy, is very important. If you are having spotting and a missed period, low abdominal pain, it's always important to rush to the hospital. Don't stay at home, because your ectopic pregnancy can be complicated and you might even die, because you may die from excessive blood loss, you may die from shock. Rush to the hospital as soon as you feel any bleeding in early pregnancy, in the early weeks of pregnancy. It may be anything, but rush to the hospital, because one may not know what the cause is. So endeavor to come to the hospital each time you have those complications. Thank you, and see you next time. I hope this video helped you. Bye.